I was the perfect example of what you should never do to your skin when I was young. When I was a teenager, I hit the beach without any sun protection at all. I had flawless skin back then, and I figured that I would forever. Then my 30s hit, and suddenly my cute freckles became age spots. I had dark circles under my eyes, crow's lines, and sagging skin. I was so vibrant and fresh looking when I was young.
That was Bianca, who, like many of you watching right now, wants to help refresh her outside so it looks more like how she feels on the inside. So building on the vampire craze, there's now a vampire facelift that uses a patient's own blood to help them look younger. Dr. Orton's going to perform it on Bianca in just a minute. It's a crazy concept.
Well, it is. And, you know, we plastic surgeons, some of us have gone vampire a little bit. But it's a great concept. And in Bianca's case, not ready for surgery. She doesn't want surgery. So what we're going to do is give her a more youthful look, a facelift of sorts by adding volume. So this is the way Bianca looks. I mean, you saw her pictures, beautiful, went through that transition. And what's bothering Bianca is that she's lost volume in her face. And by putting volume back in her face, by building up in the cheekbones, by filling the so-called tear trough to camouflage the bags that she's formed around her eyes, her mid-face, adds some volume in here, we're going to give her more of the look that she had 10 years ago, 20 years ago. Now, we did that in the first stage. The first part of our vampire facelift, we took her own fat and we mixed it with her platelet-rich plasma. That's the key. That's what we're injecting. We actually are sucking that blood out.
Hence the vampire.
Hence the vampire. So that was the first thing. We took her fat, mixed it with her own blood, and injected it to add volume. Today, we're going to fine-tune it. Stage 2. So today, we drew some more blood, and we're going to add that into these lines around her face, the corner of the mouth, right in here, to give her a lift and help eradicate some of those lines.
So similar to all the fillers you've used, similar idea, but it's
This is your own tissue. This is just taking her blood, spinning it. The key thing is that we're separating, and you know your blood physiology, we're separating the cells from the liquid part of your blood. So we're separating red blood cells, white blood cells. We're left with plasma. What do we want in that plasma? Well, we want the platelets, and we want growth factors that we know stimulate your body to regrow your own collagen, promote elastin growth. So that's why it works. And we're going to do it right now.